Good afternoon, I'm Charles Lejano. This is One News Now. The city government of San Juan, in cooperation with the Transport Coalition, sets up pop-up lanes for frontliners and residents who have gone back to work using their bicycles. Lino Lavario tells us more.
The local government of San Juan launched the first phase of the city's pop-up bike lanes, coinciding with the celebration of the World Bicycle Day. Mayor Francis Zamora, who led the kickoff event, explained that bicycles will play a huge role during the pandemic and transitioning to the new normal.
Yung paglulunsad natin ng bicycle lanes dito sa San Juan ay sakto ang timing sapagkat marami sa ating mga mamamayan ay naghahanap ng public transportation.
According to Zamora, Phase 1 will be from N. Domingo Street, Ortigas Avenue, passing through some major establishments, including the San Juan Medical Center and City Hall. It will be expanded later on to a 13.8-kilometer stretch. Zamora is encouraging people to bike to work. In fact, the city government is giving 100 free bikes to City Hall employees.
I would like to encourage my fellow mayors, of course yung mga governors natin, to also implement bike lanes in their cities and their provinces. Lalong-lalo na ngayon sapagkat yung coronavirus talaga ay nagdulot ng malaking pinsala sa atin at binago nito ang buhay ng bawat isa.
Zamora has tapped the local police as well as the City Environment and Natural Resources Office to monitor the implementation of bike lanes. For now, barriers have been set up in some areas while lanes have been painted yellow. There are also directional signages. The Bike Lane project is in partnership with EDSA Evolution, a group of organizations that aim to make bicycles a staple on roads. Keisha Mayuga, founder of Life Cycles PH, says the initiative acknowledges the need of infrastructure for cyclists.
Importante na markahan yung bike lanes para aware din yung mga motorists and road users na may bike lanes, and yung pinakamaganda talaga is for protected bike lanes.
Augustus Inocencio, a pro cycling marshal, feels motorists are becoming more aware of sharing the road with cyclists.
Malaking tulong to lalo na sa mga bike to work dahil kaming mga professional bikers, nakikita namin yung hirap nila. So in-advocate namin ito para kausapin si Mayor na bigyan sila ng daan.
For News 5, Lynn Olivario, we are One News.
Although the tourism industry is raring to recover from the crippling impact of the pandemic, the tourism department says safety is still their priority. Leisure trips are now allowed in areas under modified GCQ, but Tourism Chief Berna Romulo Puyat warns that traveling may never be the same again. For one, popular local destinations now have to impose limits on the number of visitors they can accommodate at any given time.
With this COVID, wala pang vaccine, kailangan talaga i-limit yung number of tao na aakyat sa Baguio. For example, with regard to Boracay, the carrying capacity is 19,000 a day. So it has to be half of that or even lower. I noticed naman, I'm very grateful to our tourism stakeholders. I noticed that when I talk to them, gusto rin nilang safe, slow but sure.
Hotels and other guest accommodations also have to adapt to the new normal in tourism. For instance, large groups of travelers now have to book more rooms since only 2 guests are allowed per room.
Filipinos are touchy, but now hindi na pwede. Wala na yan, di ba? And then, number 1, when they enter, dapat temperature, to take their temperature. Tapos, instead of giving, di ba, you get juice, calamansi juice, mango juice, now you get a face mask and a hand sanitizer. Ganun na yun. Yun na yung mga protocols. And then, like for example, as of now, hindi na pwede yung 5 in a room. At maximum, 2 people in a room, dapat 2 meters apart. That's according to the Department of Health.
Authorities inspected an apartment in Makati where pork meat from China was allegedly being stored and then sold online without the necessary permits. Marlene Alcaide reports live from Makati to give us more details. Marlene.
Senyas ka lang, baka barinig ka. Charles, the NBI Special Action Unit inspected a two-story apartment in San Isidro, Makati after 4 of its customers allegedly suffered food poisoning when they bought pork from the shop. The NBI, together with other local authorities, inspected the apartment this afternoon. The apartment is full of sacks and boxes. When NBI operatives opened them, they saw imported meat labeled, some with Chinese characters. Makati City Sanitary Inspector says the team even saw some meat products on the floor. They say the items may be easily contaminated if not stored properly. NBI also pointed out that importation of pork from China is temporarily banned because of the threat of the African swine fever. Makati officers meanwhile found out that this shop does not have the documents to operate. They believe the owners are selling their products online.
Nasa floor lang yung mga imported products. Supposed to be nasa ano po siya, nasa chiller, ganyan. Kasi mako-contaminate siya nasa side lang. Ayun po. Tsaka walang naipakitang sanitary permit at saka health certificate ng mga tao.
Ang chine-check natin sa ngayon, yung permit, wala sila may present kahit na yung mga nag-work sa wala rin eh. Dapat dumaan sila sa proseso ng halimbawa, meron sila yung FDA, registered siya sa mga NMIS, which is kailangan siya sa dokumento, sa permit. One of the requirements, wala rin sila. Wala sila lahat na maipakita maliban sa permit.
Charles, 4 Chinese nationals were inside the apartment during the inspection. All of them don't speak English or Filipino. They were brought to the NBI office for further investigation while the Bureau of Customs arrived and seized the goods since the Chinese nationals failed to Charles?
Thanks for that, Marlene. That was Marlene Alcaide reporting live from Makati. We'll be back with more stories after a quick break. Stay with us here on One News Now. Good afternoon, I'm Charles Lejano. This is One News Now. COVID-19 cases in the Philippines inch closer to 20,000. On this day alone, the DOH reported more than 700 new coronavirus infections. Around 200 are fresh cases, while 530 are late. 8 people died from the SARS-like disease overnight, raising the death toll to 974. Meanwhile, 90 more patients have recovered, and so far, more than 4,000 people have gotten better from COVID-19 in the Philippines. In today's briefing, the Health Department explained the importance of keeping track of the country's so-called critical care utilization rate. To tell us more about this, we have Jen Calimon live from Malabon. Jen, good afternoon. Could you tell us more about this critical care utilization rate, or CCUR, and why is this important?
Charles, the critical care utilization services or units show if our healthcare system can still manage more patients who need higher management and treatment, and if we can still supply the resources needed. Aside from testing and contact tracing, the last line of defense are in hospital settings, treatment, management, and critical care. If a person has they have symptoms of COVID-19, he or she will be given proper treatment, whether that patient has mild or severe symptoms. So here comes the critical care utilization unit, which includes facilities and ICU units and beds, ventilators. So if we have higher critical care utilization unit, more patients would be able to use more beds and ventilators.
You mentioned that this is the last line of defense against COVID-19. What is the current CCUR of the country in terms of actual beds and ventilators?
Well, as of June 2, our critical care utilization rate is 35% for ICU beds and 18% for mechanical ventilators. We have enough beds, but according to Dr. Catherine Reyes, the Associate Dean for Research of the College of Public Health, we should not be complacent because the number of patients might increase in the coming days or weeks. So we need to provide a buffer in terms of the number of beds and other facilities. Charles?
All right, so we're still doing okay, but then how does this number compare to the CCUR in other countries? And more importantly, how do we keep our number low?
Well, Charles, in some country, they need to issue a policy to rationalize which patient is to prioritize in terms of giving critical utilization service. Example, in Brazil, there were days which they where they recorded higher fatality rate than those who recovered, possibly because of poor critical utilization services. That's why our health department maintains their guard, and they continue to provide buffer for our critical care service, and they continuously procure facilities for referral hospitals. Charles?
Right, I understand that this number is just one, but then is this the same for hospitals in rural areas? What's the situation over there compared to here in NCR? Are the hospitals in the provinces equipped to provide critical care?
Charles, Metro Manila and Iloilo have better critical utilization units. Unfortunately, not all hospitals have critical utilization units. That's why the DHL hospitals in the province to know if they have enough bed and facility for critical care. If patients need critical care, a good referral service or good referral system must be planned ahead so they know where to bring those patients. Second, which is also important, is the containment of the disease. If doctors know how to contain the disease, there's a high chance that they don't need critical care services anymore. And Dr. Reyes said that we also have to be vigilant in terms of the number of cases to know if we need more facility in the critical utilization service. Charles?
All right, Jen, it is World Bicycle Day, and incidentally, it was discussed in today's briefing that biking actually helps prevent both communicable and non-communicable diseases. Could you tell us more about this? This is quite interesting.
Well, Charles, the health department recognizes that bicycles are a good alternative mode of transportation, especially that most public transportation are still suspended. And aside from this, yes, biking is good for our health and may prevent communicable diseases such as cancer and other cardiovascular diseases. But there are reports of increase in bicycle prices. That's why the DOH is appealing to sellers to avoid overpricing. They also appeal to other agencies to make our roads safe for bikers, providing bike lanes. An organization proposes hospital bike access loops for healthcare workers because they need special transportation needs and they are at risk at work. They also suggest to have a dedicated and protected bike lanes along the corridors and at the intersections, installing physical separators between bike lanes and carriageways, and a specialized signage for bicycles, and also manpower for bike counts. They have also identified
Right, we're having some technical difficulties. That was Jen Calimon reporting live from Malabon. It's now time to take a look at the global situation of the COVID-19 pandemic, again via this interactive map from Johns Hopkins University in the States. The total number of confirmed COVID-19 cases around the world is nearing 6.4 million as of this afternoon, and more than 1.8 million of these came from the hotspot itself, the global hotspot, the United States, where mass demonstrations against police brutality are still taking place. Talking about mass demonstrations amid the pandemic, we have the same situation in Brazil, the country with the second highest number of confirmed cases at over 555,000. This is followed by Russia at over 430,000, UK with over 207,000 cases, Spain with nearly 240,000, and Italy with an excess of 233,000, and India with over 208,000. It's 208,252 for India. Moving on over to this side of the map, where the global death toll has now topped the 380,000 mark. That's 380,580. The U.S. still tops that list at 106,181 deaths. And that's the most fatalities, way ahead of any other country. Incidentally, George Floyd's death in Minnesota also sparked protests since racism and police crimes in other countries, including the UK, which has the second highest death toll at almost 40,000. That's 39,452 deaths, followed by Italy with 33,530, 31,199 for Brazil, almost 29,000 for France, and for Spain, 27,127 deaths. Moving on now to the Ivory Coast, where drones are helping out farmers and miners accomplish more tasks. Stock checks and growth reports that until recently have been done on foot are now being completed in record time thanks to these machines. The technology is creating particular interest in research and development of agriculture, and they are being used to help farmers observe farmland, test soil quality, and calculate the levels of chemical fertilizers. For more updates, be sure to follow News 5, Philippine Star, and Business World online. I'm Charles Lejano. We are One News.